All right, cool. So we're up now. This is Eric Uvigis of the USA DPT Advocacy Group. Today we're interviewing Dr. Ben Fung. He's a PT and MBA candidate out of San Diego, California. He's going to be talking to us about CSM review, some of his background, some student debt information, and maybe some salary negotiations, things like that, and his take on the future of PT. So take it away, Ben.
All right. I guess a little background about myself. I graduated in '09, and I started working right away in acute care. At the time, the conventional wisdom was you get into a hospital, you take a look at the craziest diagnosis you could possibly imagine, get into all the blood and guts, and get spilled on everything so you were christened properly for the clinical setting. I did that for about 3 years, and at which time the life cycles of all of the management possibilities and the opportunities in the organization kind of topped out. And so I didn't want to wait for 10, 15 years for another shot at moving upwards. So I left the organization for a promotion as director for a CCRC, a senior community. Did that for about a year, and then unfortunately was asked by corporate to do a lot more than I was willing to do. And I value family first. And so I quit that for a while, took a sabbatical, and then I worked for home health. And I did that for a little bit longer, and I decided I'm just going to be a consultant. And that's essentially what I've been doing ever since. Finishing up my MBA in April, and that's kind of the skinny about me. As for CSM, who went to CSM?
Three people.
3 people? Okay, how'd you like it?
Learned a lot.
Yeah, they loved it.
How about one by one, what was your kind of top take home or thrill or just a general excitement about your experiences?
Is that the case? What was your favorite takeaway?
Let's see. Can you hear me?
Oh.
Yeah, I can hear pretty good.
Peace out.
My top, the best part of CSM for me personally was meeting with the student board and also with the Foundation for PT for all the meetings that I had, and just networking and getting to meet the people that I follow on Twitter, which was really awesome. And the sessions were amazing. I really, really enjoyed going to the sessions. It's definitely things that we don't always learn here in school. It's a little bit of a higher level, but I did feel like our school really prepared us. That was awesome.
Very cool. All right, who's next?
I was put in the mentorship for the ortho section, and from all the different sections like sports PT, I really liked it how all of the clinicians kept saying, we're here to be mentors, we want to guide you in the right direction, and you just need to ask for questions, ask for help. And it was also really reassuring sitting in on the higher level ortho and sports ones that I went to, and understanding what was going on. School really did prepare us so far. I am a 5th term, but it was really good.
Very cool.
Anybody else?
All right. So is that you, Eric?
I think that's it.
Okay. All right. What I'm hearing is actually really consistent with what I'm seeing out there. There seems to be a really neat, positive, dynamic culture shift in our profession, especially with those that are engaged. What used to be the case was, new grads are fodder, right? You don't know anything, you've learned only just enough so you don't hurt people. And I think we've reaped a little bit of those bad seeds just as the professional culture over the years, to where there's just really this atrocious existence between new grads and those that are experienced, quote unquote. And what's really cool now is that that's really starting to wash away. That hasn't done our profession any good, and I think everybody's seen that. And what you're seeing reflected in CSM is kind of the general representation of what most clinicians out there are ready to do for you. They may not come right out and say it. I think it's still a little bit taboo in the workplace to be that opening and that welcome of new grads and just teaching you all of our secrets and that kind of thing. But really, it is better for the profession at large. That's a lot of fun here with you guys to give you any kind of tips and answer any kind of questions you have. But what I really like about it is that the leadership now is such that it transcends all the normal workplace barriers that we're used to seeing. And you are coming into a really exciting generation where your ideas are very, very welcome. So it's a cool time. It's a very exciting time. What's next on the topic, Eric?
Ben, what do you think your biggest takeaways were from CSM, the things that you learned the most, other than the student interaction?
Well, last CSM I attended was 2013, and I couldn't get enough of it. It was it was in San Diego where I'm from, and so it was a lot of fun just to see everybody also and to connect with all the people that we have these digital relationships with. And there was a lot more clinical focus at the time, and just in 2 years, you're seeing a lot more in advocacy, you're seeing a lot more in leadership, you're seeing a lot more in empowering women, and the empowering of students, which is really cool. One thing I could have taken more from would be the branding and the marketing and the progression of our profession in the eyes of the consumer, in the eyes of our patients at large. And I think we're going in the right direction, that internally we need to unify, and the leadership needs to kind of take us at least in the same 180-degree focus, and then we can narrow it down. And then after which, I think we're going to be able to do some really good things on the legislative front so that we can practice to the top of our credentials, so that our license can reflect what we're taught and trained to do. So I think that was my takeaway, that we're poised for that, and in the next coming very close years, we're probably going to see some very exciting shifts in that direction.
That's awesome. I couldn't agree more. I think there's a lot of that information that students don't necessarily understand until you're getting closer to graduation. It's like, oh God, what's going on in the world? So to hear that coming from you is great. I think it's very helpful. You mentioned a lot of things in your blogs about student loans and student loan repayment and things like that. What sort of tips would you have for us coming out in the next year or two on how best to manage our debt and to get those loans repaid?
All right, loaded question. Just to survey the classroom, who's intending, or at least right now intending on working for outpatient orthopedic settings?
Probably about half the room.
Half the room? Okay. How about in the acute care hospital setting?
Maybe two.
Oh, come on now. How about SNFs? Any interest there at all? See a hand or two?
That's a zero.
And home health?
Home health? Maybe 3 or 4, if possible. A lot of maybes.
And then how about the rest of the slew? Sports, pediatrics, specialties? Okay.
Probably 10 or so.
Okay, so that's where it mostly is. All right, very good. So to address that, those that had interest in home health and I guess 0 for SNF, those two segments pay the best in general when it comes to any PTs, new grad or not. A lot of that has to do with the work-life balance required. A lot of that also has to do with the geographical requirements. A lot of the SNFs and home health regions are really vast, so you spend a lot of time driving, or you have to drive way in the middle of nowhere, move into the middle of nowhere to make that kind of money. And so they pay pretty well just to get you out there. For outpatient, outpatient can be kind of tricky, depending on the organization, the corporation, what policies they have. Some have fixed rates, and so if you're a new grad, you get XYZ. No questions, no negotiations, nothing. Those organizations tend to be a little bit bigger, Their benefits usually are pretty good. The mentorship isn't bad, but the challenge is breaking through some of those old cultural barriers. Some of the medium and small size organizations or private practice firms, depending on how you get referred in there, how you do with your interview, how your clinical skills are reflected, they're willing to pay you a little bit more and pretty quickly, especially if you've demonstrated some early success, say residency, OCS, fellowship, what have you. And that's 2-3 years post graduate investment times. The final segment of acute care, that's all depending on how much that hospital needs labor. A lot of the ones that are more rural or in states that are less populated, they're willing to pay, $15,000 for you to move out there, just because they need that manpower. They're spending so much money on traveling physical therapists, on local, per diems, that they much rather invest in you and have you commit a year, 2 years in that region, or at least hope that you do, and make that cost-benefit shift. So those are some just early things to consider. Now, in terms of strategies of paying stuff back, I wrote on my blog that I really advocate paying the highest interest rate stuff back. It's just the easiest way to not lose your principal in terms of what you're giving away to just the interest payment, and then what you're actually cutting away from your actual debt. The other thing I really advocate for students to do is look for 2-3 times on the weekends per month some type of inpatient work that pays really well. Unfortunately, most of the time that's going to be a SNF. Every once in a while, it is going to be an acute care hospital, which is a really good learning experience. But they're going to pay you, a lot more. We're talking when I was the director at the rehab program for the CCRC, I was paying new grads $37 to $40 an hour as part-time, full-time. Then the PTs that were working there just on the weekends, they were getting $43, $44, $45 for the hour. And then the ones that are calling from outside agencies, the differential rate I think was the PTs were getting 65 to the agency, and I think the agency was taking 10 off of that, so it's going to be $55 for the hour, give or take, depending on your market. Those are really good opportunities. You work for 4 hours in the morning just for some evals on a Saturday morning. That could easily be almost a full day of pay at your normal job. Those are really good ways of picking up some extra cash that you can budget out and then pay back to your debt. The last tip I have is power pay. Eric, I don't know if you're able to do like a screen share or demonstrate the link up there, but it's one of the many online softwares that allows you to budget out a monthly amount that you can pay off towards your debt, and you'd be really surprised at how quickly you can pay all that stuff off, depending on what your life goals are, where you want to live, what your how much fun and how much money you want to spend in life. It kind of budgets it all out for you, and it's nice because it's regular, and so you don't have to worry about what if these expenses or what if those expenses in these various ebbs and flows of the year. They can actually help you take that into account.
Ben, can you repeat the name of that site for everybody?
It'd be powerpay.org. Let me just confirm that.
Okay. Just making sure.
Yeah. Yes, it is. It is powerpay.org. And it should be a free sign up.
Even better. Cool. Anybody have any questions for Dr. Fung? Yeah?
Hello. I was just wondering if you could speak on how being an MBA candidate has impacted your career as a PT, and what resources or paths would you recommend for a new PT towards successful road to entrepreneurship?
What was that last part? I'm sorry, I got garbled.
What resources or paths that you would recommend for a new PT towards entrepreneurship?
Okay. So in terms of the MBA, the story there goes, when I reached that ceiling because of life cycles in the organization, I actually went straight to the CEO of the hospital. And I asked him, what do I need to do to break through this? Can I break through this? And he kind of looked at me and took a second. He said, because of where healthcare is, if you want to get into the upper and senior management levels, into the C-suite, to make some organizational changes and perhaps some policy changes at the state level, you're going to have to get an additional degree. While the DPT is a very powerful doctorate, it is a clinical doctorate, and so it doesn't reflect, in terms of the administrative process, it doesn't reflect automatic understanding of administration, of business, of politics, of navigating large corporate organizations. And so his suggestion was for me to get a master's in either business, in healthcare, or even just in public health. Anything additional just to give that little bit of an umph, so that when my name's pitched in against, say, RNs, other MDs, perhaps PhDs in the pain or psych program, that I can stand out a little bit as both a strategic mind as well as a clinical mind. Now, the way the MBA has affected my perspective as well as my career has been unspeakably huge. It really has really accelerated, I feel, my career path, and it also has really opened my eyes up to not only the problems, but also the realistic solutions we have both in our own profession as well as healthcare at large. So I really advocate for anybody that has some kind of interest in the business, go look right through into it. If you don't want to spend the time and the money on the degree, since you already have plenty of that invested right now, there's a lot of online resources. Myself, Jerry Durham, Ann Wendell, there's a lot of people that are willing to share out their secrets, because the more we share amongst each other as colleagues, the more we're going to benefit at large. I've shared many times the collaborative versus the competitive model, as well as what is known as the oh gosh, it's skipping me, the prisoner's dilemma. It's an equilibrium where I can either share out my secrets with my colleagues, or I can keep to myself. But what happens economically is, if we mutually decide to share, we benefit that much more in the long run. If we compete against each other, eventually we're going to just grind each other down. There's not really going to be a clear winner. We're both going to be losers. Now, in terms of what resources, I mentioned these blogs. There's a lot of great PTs out there that I'm sorry, I just can't think off the top of my head quick enough to list everybody. But there are a lot of resources out there, and there's actually a lot of great free websites that are just business oriented. Investopedia actually is probably my favorite just online business resource. If you're looking into general concepts, even formulas, metrics to measure your entrepreneurialism, Investopedia is a very good place to go. The final place that I would take a look at would be things like the Harvard Business Review. Publications from that. Stanford, USC also has a good one. Obviously, I'll have to make a shout out to Michigan, because that's where I'm getting my MBA from. Disney Institute's always somewhere that I like to look at. Wall Street is also pretty good. Just perusing that frames your mind a little differently. And I think that's what's really changed my perspective. My perspective prior to entering this MBA program was perhaps this big. And through this process, my mind's really been opened up, so I can see a lot more breadth and depth in the business as well as the administrative solutions to our own profession.
Okay, thanks. We got a question from Brooke McIntosh on Twitter. She asked if you have, or she said, she was wondering if you have any advice for staying involved in leadership positions during the transition from a student to a new professional.
That is difficult. In the workplace, you're kept pretty busy, and so it can be difficult to maintain that kind of momentum that you have right now. I'm actually really proud of all of you. I'm really impressed that you're here on your lunchtime, because even 5, 6, 7 years ago, when we had any kind of opportunity like this, it'd be 3 students, 4 students. So it's really cool to see so many of you interested, or at least very willing to just chat with me. The way to maintain the momentum is absolutely through mentorship. Without mentorship, once you reach graduate school and you get into the workplace, you kind of reboot yourself. You start all over. You're at the bottom of the totem pole again, and sometimes it's not easy just on the person yourself to maintain that and to mature through that next level. I think mentorship is one of the best ways. Obviously, staying a member, of the APTA is, it's a must. If you're not like that, you won't be able to maintain that connection with the professional organization, which is the only organization we have. With that mentorship, along with just general support, I would advise through social media because it's simply the most accessible and realistic. That is the way that you can continue that link of opportunity. I can't tell you how many opportunities I've been attached to simply because of social media. Just following on hashtags on Facebook groups, you get a lot of private connections because they're interested in you, the person, and that's really what it is. Maintaining that momentum is maintaining the momentum of progressing you as a person in your growth, in your development, in your maturity, and in gathering perspectives and capacity. And your capacity, your formal ability as students now is huge compared to what we used to be at. So all you need is somebody there just to keep coaching you on. And for students like Brooke and the many out there, Eric, yourself, and everybody here in the room, I can't encourage you enough just to start by connecting with people online, because you never know where you're going to end up. And who knows, you might end up in my backyard and go, hey, Ben, is there any opportunities in San Diego? I'm like, sure, let me connect you. And from there on, let me connect you to some of the local leaders, or maybe some of the regional leaders, or the state leader. Maybe let me connect you to some of the schools in this region. Maybe you can become an assistant instructor and start your own cycle of developing students in the following generations.
Awesome. Definitely can't speak enough to the benefits of social media. It's an easy way for you to get passively involved, and even if you don't want to interact with everyone, you can just sit back and watch the conversations happen, or interact in brand new conversations like this one. So thanks for that. You are also a big fan of kettlebells, I've seen. Have you been able to implement any of that work with your patients? Say with even your lower level patients in home health, or probably not in the acute care, but in some ways that people may not expect.
So kettlebells is typically that outpatient ortho sports med, very high impact, high performance population. What I've been really surprised to see is how well how some of the geriatric populations respond. Primarily because it's different, and it isn't as threatening. You'd be surprised than heading into traditional weights or traditional resistance exercises. One of the things I tend to preach about kettlebells is that because it is a free weight with a handle, it's very much like any other object that you get in life. And so I think that in that geriatric population where the motor control may not be as good as they used to be, a lot of the natural responses kick back in. Postural rightening, even the ankle hip knee strategies, a lot of those kind of just suddenly appear again when you give them that angular momentum. You get kind of a proprioceptive response and a sudden rightening of everything that you're looking for as a PT in those populations. I don't ask them to do snatches. I don't ask them to do Turkish get-ups, obviously, but what I do have them do is I actually tie either a sheet or an old T-shirt. Sometimes I use my old martial arts belt, and what I'll do is I'll just have them hold on to it with a really tiny bend in their knees, a little mini squat, and I'll just swing it, and I'll stop the swinging momentum at various stages so they can't just expect a normal cadence of momentum. You'd be surprised what they can do from there, and they can do these extended swings, not formal kettlebell swings, but it's a very good opportunity to show these, the geriatric population what they're fully capable of. And you'd be surprised. I think I have a video with a 79-year-old woman doing relay swings, where she's swinging I want to say it was an 8-kilo bell at the time, and she would swing 3 times, toss it in the air, and I would run behind her and get it, and I would do the same thing, and I toss it to her. she's 79. So the capabilities of using functional movement and that whole functional exercise culture, it does apply to the geriatric population. You're just not asking them to snatch 53 pounds overhead.
No, but if you got grandma back to that point, that would be pretty awesome.
Videos out there.
Anybody else have any more questions? I know in another recent post you talked about where you see the future of physical therapy going. Could you kind of speak to that and inform anyone who may not have read your blog about some of your thoughts?
Sure. So, I started this last calendar year, and I just kind of threw some thoughts together, just where I was, in my career and transitioning to consultantship, where I saw the profession going. So I did it again for this year and put a little bit more, some bolder spins on my predictions, and just really putting a stamp out there to where I think I see things going. The first thing I was advocating for was for PTs to think beyond the clinical realm. If we are to truly practice at the top of our credentials and to practice at the top of our licensures, we have to think beyond the clinical setting, because that's where everything is going. That's where healthcare is. If we're only clinicians, we're only going to be regarded as that. And pretty soon, if that's all we are, then we're going to be reduced to technicians. But if we're practicing as true doctors of physical therapy at the top of our credentials, everything we've learned to do, everything we're trained to do, everything we know, that pushes us into business, that pushes us into legislation, that pushes us into policy making, professional advocacy, consumer advocacy. It pushes us to become community leaders. And that's what I'm really advocating for the next generation to become, is to become visible community leaders. It's great that we have institutes of excellence and clinics that are renowned for shoulder, just famous for backs, great for peds, you name it. That's wonderful, and that's great in those segments of the market. But to really transform society, right? Because that's our goal. To transform society, we have to be part of it, more than just in the confines of the treatment table. We have to get out there and be visible in a way where we interact with society as a professional construct, whether it's friend, business person, colleague, provider. And that's what's really going to transform society from our end. The other predictions that I see is us getting into more data-based treatment patterns. Just because of where insurance carriers are trying to go and the money they're trying to save, as well as the margins they're trying to make for their shareholders, you're going to see a lot of that occur. I think Kaiser's probably the best example of people that are doing that, where certain treatment-based protocols are already in play. And so they're saving money and also making long-term gains by treating certain populations in a controlled manner. It's a little bit unnerving, though, because it does turn populations into a statistical pattern. But I do see that as the next emergence in our payment paradigm. So that's a good thing to just get familiar with. I don't think that's necessarily best for patients at large, per se, but there's a big shift into that. So it's good to understand that data. If you guys are having statistic classes, it's a good time to pay attention to at least what the general concepts are. I've taken probably 4 or 5 statistics courses over the years. Every time it just feels like I'm going through it for the first time, so don't feel bad about that. Other predictions I see are going to be disruptive patterns, and that does have to do with us practicing at the top of our credentials. I've been hearing a lot of physicians on the national platform advocating for PTs to get in there as adjunct primary care providers. And that's very exciting to hear MDs talk that way. They're realizing that, this whole pattern of referring here, deferring to that, waiting, refer, defer, defer, refer, it's inefficient, and the large schemes, it's wasting a lot of time, a lot of potential health gains, and a lot of money. And so there's physicians out there that are advocating for PTs to be incorporated into a pilot model where yeah, any basic musculoskeletal concerns, you come straight to us. So that's also a very exciting thing to see, and that's something you as students can, as the platforms are, they get larger, they get more engaged, and the editorials and the pilot studies the very clinical commentaries, when they come out there, you can present that to your affiliations, and you can present that to your workplaces, as they progress, and that's how you can help progress that future and make that a reality. The disruptive model also has to do with how we treat our patients and how we engage them through telehealth, through apps, through technology. And there's various forms of early intervention that I'm seeing occur where people are using work patterns and injury patterns to predict injury. And then PTs go back in there to screen out possibilities. And large contracts are being formed that way, where PTs will start their own firms that directly deal work comp issues as well as any kind of basic physical health concerns for mid-sized companies that don't want to contract out because it's just too much money for them. And it's easier just to pay a small PT firm, say 3 clinicians, to do that for them at a win-win situation. The PTs will make more money, and the organization itself will save more money. So there's a lot of business-based and pattern-based opportunities coming through in this coming year, is how I see it.
Awesome. Any last questions? Anybody think of? No? All right, Ben. I think we're going to wrap it up so that everybody has time to get to our next class. Can you just tell people where they can find you? Any last closing remarks you want to make?
Sure. Well, you can find me, on Twitter. It's just at Dr. Ben Fung. My website is the same thing. It's drbenfung.org. I've been pretty active recently on the DPT student Facebook page, so you can find me there as well. I'm pretty easy to find these days, so you can just go ahead and stalk me and then send me a message. Happy to support you in any way that I can. I really, really am. It's so fun to see the surprise when students approach me and, oh my gosh, you replied my email right away. That's just how I do things. I believe very firmly in supporting you guys. And you're the future, of our, branch of healthcare, of our branch, of our brand, of our profession. And I very strongly believe that our support of you is going to lead to the success, of healthcare at large, as well as, a lot of the economic welfare of our society at large. There's a lot of good I see you doing. And it's a very exciting time because I'm seeing these generational gaps being closed. I'm seeing a lot of the barriers being knocked down. I'm seeing that the opportunities are being awarded to high performers, no longer just because you spent 15 years in the profession. You're being rewarded and promoted and recognized for what you do and who you are, rather than the length of time that you've done anything for. And so I suppose kind of a closing encouragement for everyone is seek a mentor, seek encouragement, seek empowerment, because it's out there. There's plenty of people like myself and so many people on Twitter and various other outlets of social media that are ready just to give you the tips, to walk you through the mistakes that we've gone through, and just to give you the ladders that we walked up and that we had to build for ourselves. We don't want you to suffer. We want you to excel. And that's what I see you guys doing. Take advantage of those opportunities and get out there, make some guided mistakes, learn from them, create your own ladders, create your own steps of success, and then pass it on. It's just, it's a very exciting time. I keep coming across that. I find that 2015 is that year of adventure. It's that year that we get to experiment and to explore and to try these new things with only benefits to come across. And I'm thrilled that you guys get to be in this this time and this generation to be a part of this shift and to be part of this movement. Go transform society.
Awesome. I think we can all agree with that. Thanks for being here, Dr. Ben. We all appreciate it. You can bring a round of applause. And we definitely look forward to keeping in touch and maybe doing this again soon.
All right. Been my pleasure. Best of luck to you guys, and find me if you need anything at all.
All right. Thanks a lot. I'm going to go ahead and stop the broadcast.